morning, everyone. Hope everyone's doing well on this Friday, last Friday of June. Thank you for joining us today for this morning's CME. And this morning we have joining us Dr. Shamanique Bodie Williams, and she's joining us from Freeport. Dr. Bodie Williams is a member of the Royal College of Obstetrics and Gynecology. She's a fellow of the American College of Obstetrics and Gynecology, and she's also a member of the American Association of Gynecologic Laparoscopists, a member of the World Association of Laparoscopic Surgeons, the European Society of Aesthetic Gynecology, the International Society for the Study of Vulvovaginal Disease, and the European Society of Gynecologic Oncology. She started her early education in Nassau, where she graduated at Kingsway Academy in 1996, and she was the valedictorian. And then she went off to the University of North Texas, where she started her health sciences education. Most recently, she's a graduate of Northwestern Feinberg School of Medicine in 2004, and she completed her obstetrics and gynecology residency in 2008 at the University of Texas, Houston Health Sciences Center. She also completed the World Laparoscopic Hospital Diploma of Minimal Access Surgery, which was done in India. And she has an MSc in clinical education from 2018 from the University of Edinburgh in Scotland. Her present position, she is a consultant obstetrician gynecologist. She works privately at the Bahamas Wellness Center, and she's a consultant in the Department of Obstetrics and Gynecology at the Rand Memorial Hospital in Grand Bahama, Freeport. She has many awards and publications, some of which include in 2019, she received the top CME of the Year award from Doctors Hospital. In 2008, she received the Gold Foundation Humanism and Excellence in Teaching Award. And in 2019, she presented a poster to the Royal College of Obstetrics and Gynecology in England. The topic of that poster was viral mosquito-borne illnesses in pregnancy, looking at the Aedes aegypti mosquito. She is, Dr. Bodie Williams, involved in presenting on a regular basis to nursing, medical, and also to the wider community. She participates in audits and is very involved in management, and is actively involved in teaching and volunteering with the Cancer Society, the Family Planning Society, and an after-school education program, and is also involved with Hands for Hunger. And so with all that being said, it's my greatest pleasure to welcome Dr. Bodie Williams with us this morning. And a little known fact is that she is also a qualified Swedish massage therapist. Welcome, Dr. Bodie.
Thank you. It is indeed a privilege to be here this morning. And as customary, I'd like us to please let's open with a word of prayer. Dear gracious and heavenly Father, we just give you thanks and praise. We honor you for this day, Lord. We thank you for all those that are here safely, and we thank you that wherever they are, that you continue to give them protection and guidance. And Father, I thank you now that as I speak, that I decrease and you increase, and that this word may be useful. And in Jesus' name I praise and thank you, Lord. Amen. Now, I'm not a tech savvy person, so you'll have to work with me. There was a video song that I had in the presentation, but it's not playing, so I'm going to pull it up. Okay. Dr. Holliday, can you help?
Dr. Halliday may not actually be with us. There are DM meetings this morning and exams. I'm sorry about that.
Okay, here we go.
Once I fall in love, then I'll be happy.
Just so you know, we're by the medical school. I'll see if I can pull him up for you.
I got it.
Once I get some money, it'll all be easy.
Today's DM exam, so we're quite busy here.
Okay, Dr. Butler, we're good. Thank you.
Once I get a little older, I won't worry. When you get older and it don't feel like it should. I'm thinking once I learn to grow right where I'm planted, maybe that's when life starts getting good. Once I get a car that don't start in the morning, I can't make it anywhere I want to this way. But I can see it right now, sitting in my driveway. Afraid if I take it out, I'll chip the pain. Once I get a house that I can hang my hat on, I bet I'll wanna build a bigger one if I could. Yeah, I'm thinking once I learn to grow out where I'm planted, maybe that's when life starts getting good. Oh, getting good. Getting good. Life starts getting good. I'm thinking maybe that's when life starts getting good. That's when life starts getting good. I'm afraid of both my parents dying. I call my dad, he answers right away. And I didn't hear a word 'cause I was thinking about what hasn't happened yet but will someday. And we hang up the phone before I know it. I'm crying over the conversation I feel too. I'm thinking once I learn to soak up every moment, I'll realize my life's already good. Already good. Already good. Life's already good. I'll realize my life's already good. Thank God that my life's already good.
So in terms of disclosures and disclaimers, I have no financial disclosure. I have no conflict of interest, but I will have a disclaimer in that I do have a passion for the education, and I have a passion to help my colleagues develop their potential. And so I want to start this morning's presentation just from a corner of gratefulness. You know, as we journey along, there are many persons that contribute to our journey, and very often we may not get a chance to say thank you, and sometimes they may not even realize to the degree which they've impacted us and how thankful we are. And it may seem small, their actions, but the implications are big. So first of all, Thank you to Dr. Beverton Moxie and Dr. Carlos Thomas, who were the only two people who responded to my emails when I sent out emails inquiring about coming home in my 3rd year as a resident. And of course, I thank Dr. McCartney, Dr. Butler, and Dr. Frankson for your support and all of your advice over the years. Dr. Rhea Johnson, when I came into PMH, I did not have an orientation, but she as the SHO oriented me and got me grounded. Dr. Charles, I scrubbed the first theater lists and first service with him. And Dr. Francis Phillips and Dr. Indira Grimes, who I took the first set of calls with. I thank Dr. Knowles and Dr. Minnis, who covered me on private surgical during my PMH days. And Dr. Black, she's an entity in of herself, and I thank her. She was the first person I called for a medicine consult in PMH. And Dr. Hui, Lord rest his soul, he's passed, and Dr. Forbes, but they opened the Freeport door for me when the Nassau door was seemingly pushed closed. Dr. Ward and Dr. Leon, I thank you for inviting me to the Freeport O&G department, and to my colleagues that have always been supportive and a joy to work with, and that spans the specialties with the anesthetists and the surgeons and the ancillary, the nurses, the A&E team, the radiology team. I've had favorable interactions with you throughout the years. And then, of course, those that were there, Dr. Phillips, Dr. Bo, Dr. Holliday, Dr. Chantal Ashanos, Dr. Inga Pratt, Dr. Seeley, Dr. Rowe, Dr. Graham, Dr. Braham, Dr. Walgus, Dr. Juma, Dr. Charles, Dr. Hall, and Dr. Moss. So I thank you all, and I thank those that I may have missed. And I think that that's an important place to start from. And so just to put this presentation into how we're going to proceed through it, we're going to go through some definitions of grow and plant. We're going to put things in perspective, and we're going to review my journey, the vanilla version. And we're going to talk about some keys to grow where you are planted and some examples to go along with these keys. And then we're going to wrap this up. So when we look at the definition of grow, it's a verb, it's an action word. And it implies that there's a natural development and you increase in size and you have to change. And that change is a physical change. And hopefully you're becoming greater in time and you're increasing.
Dr. Bodie, we lost your sound. I think you may have muted. Okay, we're not hearing you.
Hello?
There you go. Your sound is back.
Okay, and so when we look at the definition of plant, it's when we put something in the ground. And sometimes when you plant something, it's not necessarily put there intentionally. Sometimes it's just set there in that particular place or that particular position. And so why should we grow where we are planted? So as a believer, my view is that God wants us to have an impact. He is constantly looking for us to make a difference. He wants us to flourish. And to be frankly honest, if you look at the alternative to growth, it's death. And so when we look at, we always counsel patients on the risks, benefits, and options. So when you look at this, there really is no other option. And so we have to start from somewhere. And I want to put this in perspective. And we're not exempt from trials. And as we journey through, our journey may not be a smooth one, but that journey is definitely required to grow. And as my husband aptly pointed out, he said, you can't use an egg for its purpose unless it's broken. And so that in and of itself, I pondered on it, and it's the truth. And so sometimes as we go through and our stories, sometimes they may be difficult to share. Some are difficult to hear, and some stories that we have are difficult to believe, but we all have a story. And the reason I bring this up is that after Dorian, I had arranged for some medical care for the interns. And one of the interns, she said to me, she said, Dr. Bodie Williams, you at the top, you just don't understand. And the only thing that I could do is reflexively, internally smile because I understood. And so for that reason, I think our stories are important to share. And as one author, Jen Ward, said, from a book entitled Grow Where You Implanted, Insights from an Enlightened Generation. She says, your story merely sharpens the blade of your truth, and love is your sheath. So my time at PMH was from 2010 to 2015, and I was extremely excited. I was excited to be home. I was excited to have an opportunity to give back to my country. And after having had my application passed around and being unemployed for a year, I was ecstatic. And so as I reflect back, you know, I refer it as a pseudo dinosaur because I do have some time in the system. I do not have as much time as many others on this call, but I do think I have a fair share of experience in the healthcare system of our country. And I was privileged enough to participate in, these are some of the activities that I got to participate in my time. And I got to spend time under 3 department chairs and 2 medical chiefs of staff. And so I had the honor of being on the timeout committee. So the timeout that's done in theater today, I was on that committee to introduce it. We had a stillbirth committee, and we looked into maternal morbidity and mortality and every stillbirth case, and we were trying to find ways to reduce stillbirth. And this was under the direction of Dr. DePuch when he was chair. And so I was on the first confidential stillbirth inquiry committee. I had the chance to introduce Foley inductions into the department. Under Dr. Hall Watson with Dr. Griffith Bow and Dr. Holliday, we got drafted. We were the first OBGYN Research Day Committee, and we had the privilege to make that come to life. With Dr. Charles, we did the first Journal Club Committee. And so things that are probably norm today, they actually just came into existence during the time. It commenced more robust hysteroscopies, and we got to push the envelope for laparoscopy in the gynecology in the public sector. One of the first cases I could recall was on a 13-year-old, and I refused to open her abdomen. So thankfully, Kendra, who was a scrub tech, she enabled us to put together the instruments that were necessary, even though it was 1 or 2 o'clock in the morning, to be able to perform a diagnostic laparoscopy and pelvic washout, which then served and saved this 13-year-old from having a huge scar. And I actually was subject to the first reader, where we, as a department, they used the plan was to assess trainees to see where they were to determine their level of confidence and competence. And in addition to that, I also, we started our pre-clinic coffee break. So if anybody remembers that, they could stick it in the group chat, where we use this time to fellowship pre-clinic. But as my time came to an end at PMH, I walk away with description. I would encourage you, no matter where you are, to hold on to this, is that you should be strong and courageous. Don't be afraid or scared of them, for Yahweh, your God himself, is who goes with you, and he will not fail you nor forsake you. And that's Deuteronomy 31:6. And so another author puts it like this, and she's another person that wrote a book on Grow Where You Planted, Renetta Francis. And she said that this idea and concept is not new. And what it means is that you have to make the most of what you've been dealt. You have to play with the cards, and you have to pull yourself up by your bootstraps and to basically put it, suck it up, buttercup. And so in order to be able to grow, I think it is important to understand and to look at some ways, because it's one thing to tell a person, okay, well, just make it happen, just make it work. But then how do you go about this? And so these are some of the keys that I thought would be useful in terms of trying to help you figure out how to grow. And they include focus, purpose, integrity, and keep growing and help others grow. And so when we talk about focus, I love this photo. It's a photo of a banana tree that's coming up in the midst of a trash heap. And so, you know, don't mind the environment around you. Sometimes the environment may not be ideal, but no matter what that environment is like, be who you were designed to be. You mustn't accept things as they are. You cannot. And I would say, always make sure that you're doing what you're supposed to do and not necessarily what you see. As a registrar in Nassau, postgraduate training, we had a call room on top of the hill. The ONG registrars were the ones that were required to be in-house. And I think I used that room a few times. And then eventually I moseyed down the hill and moved in with the SHOs and the interns in the call room. And sometimes you would compete with the intern as they made their bed and you came in and they had their nightcap on ready to go in for a night's rest. But what it meant was that they knew where to find me. They always knew where they could get help, and they never ever felt like they were out there by themselves. And I think because of that, we were able to make a difference and save some babies and save some moms. And then another thing I would say, be that person that you want to take care of yourself, or that you would be okay with taking care of a relative. Be that person that you wouldn't mind if your mom or your dad or your sister or your brother got not well. And I can definitely say we have colleagues that when my family members are not well, that I'm willing to call, and I feel honored that they're willing to see that patient. And there are many, and Dr. Black and Dr. Dames, they're just a few, but there are many that you would trust. And so here's an example. This is the OBGYN team in Freeport, and it seems like we're getting smaller by the minute. But Dr. Pura, Dr. Espinosa, Dr. Miranda are registrars, and Dr. Isaacs and Dr. Taylor, they are DM residents, and Dr. Johnson and Dr. Cooper, they are residents to be. And this team, they influence me, and I think they probably influence me more than I influence them. But they give the example of being that person that I would want to take care of a relative. So in short, there was a young lady who had a symptomatic anemia because she had fibroids, and she was a complicated case. And she came in, unfortunately, in a period post-hurricane where we were not able to accommodate. We subsequently referred her to Nassau, and because of COVID, she subsequently got referred right back to us. And she had multiple transfusions to the point where there was nothing else that we had. And just like every other blood bank, we were short. And we made the decision at the consultant level to get her done no matter what. And we ran into the blood issue, and our team members came through and they donated for her. And this is Dr. Johnson and Dr. Espinosa. And this to me was such a moving event, in that this is something that, very often, how often are we willing to go that extra above and beyond to take care of our patients? And this to me was an example, and I thought this was very moving, and we were able to perform the lady surgery, and she's forever grateful. And so another key to growing where you're planted is focus. And so when we look at focus leaves you rooted and grounded. Like a tree has roots, and so it's anchored, and the roots are responsible for keeping it in the ground. And it's responsible for absorbing the water, the minerals, bringing in the air, the moisture, and food storage. And so I encourage every person to be rooted and grounded. And for me, as a believer, my root, my ground is in Christ. And in addition, my other root and ground is in my family. And those are key components, because when the winds of life start to blow, if you're not rooted and grounded, just like a tree in a hurricane, you are either gonna get pulled up, or the ones that are well rooted and grounded may bend and bow, and they may even break. But post hurricane, in another year or two, they're gonna be back again. And so focus is important. And so Jeremiah 17:7-8 says, "But blessed is the one who trusts in the Lord, whose confidence is in him. They will be like a tree planted by water that sends out its roots by the stream. It does not fear when heat comes. Its leaves are always green. It has no worries in a year of drought, and never fails to bear fruit." And so focus is key. Another thing that we have to hold on to and understand is purpose. So you have to understand your purpose. And I think it's important for us to realize that your purpose is it's not just your title, and it's not just your profession. Whatever title you hold today, someone else is going to hold that title tomorrow. And sometimes that tomorrow comes sooner than you realize. And your purpose is it's responsible for your very existence. Your purpose is what drives you. And once you are functioning in your purpose, you are unstoppable. And no matter where you are, you will grow. No matter where you are planted, you will grow. Growth is inevitable once you are functioning in your purpose. And another important key is integrity. One of the most memorable CME that I have attended was Dr. Tiagi, and he talked about trust. And I've attended a lot of CMEs. And this is so important. And so when we talk about integrity, each of us should examine our principles. And not only should we examine our principles, but I think we should lead by example, and we should make sure that we are communicating in an authentic and honest manner, and that we are communicating respectfully. You know, there's a lot of literature that's out there about communication with healthcare providers and the recipients of their care, their patients. But there's not a whole lot of literature out there about communication and us communicating with each other. And we are obligated that we should listen to one another. In addition to that, I think it's also key for us to be able to elevate our team members, to praise them when they do well, instead of, you know, always being on the opposite end, because I'm pointing out deficiencies. And I always say, after the CME, I might not get invited back, but that's okay. But if I do, I'd tell you, don't be a weed. You know, don't be a weed. And then we as leaders, we are responsible for acknowledging and examining our mistakes. So that means that we're not perfect. We are humans and we are prone to commit errors. But if we review them and that we're able to grow from them and learn and move on. So in the 7th edition of Dennis Chi, Practical Principles and Practice of Gynecologic Oncology, the dedication was one I thought that for the Hippocratic Oath that summed up integrity. And I know that print is small, but I'm going to read it to you. And it says, for the Hippocratic Oath, I swear to fulfill to the best of my ability and judgment this covenant. I will respect the hard-won scientific gains of those physicians in whose steps I walk, and gladly share such knowledge as is mine with those who are to follow. I will apply for the benefit of the sick all measures which are required, avoiding those twin traps of overtreatment and therapeutic nihilism. I will remember that there is art to medicine as well as science, and that warmth, sympathy, and understanding may outweigh the surgeon's knife or the chemist's drug. I will not be ashamed to say, I know not, nor will I fail to call in my colleagues when the skills of another are needed for a patient's recovery. I will respect the privacy of my patients, for their problems are not disclosed to me that the world may know. And most especially, I must tread with care in matters of life and death. Above all, I must not play at God. I will remember that I do not treat a fever child, a cancerous growth, but a sick human being whose illness may affect the person's family and economic stability. My responsibility includes these related problems if I am to care adequately for the sick. I will prevent disease whenever I can, for prevention is preferable to cure. I will remember that I remain a member of society with special obligations to all my fellow human beings, those sound of mind and body as well as infirm. If I do not violate this oath, may I enjoy life and art, respected while I live, and remembered with affection thereafter. May I always act as to preserve the finest traditions of my calling, and may I long experience the joy of healing those who help. And so I thought that adequately summed up integrity. And the last key is that you have to keep growing. And in addition to you growing, you should also help others grow as well. And when you're growing, you know, it's easy to remember that your best investment is yourself. And as you invest in yourself, whether that's through training courses, through reading, through practical observerships or internships, that puts you in a position. And do not allow anyone to devalue you. No one can take away your skill. Once you've acquired a skill, whether it's a technical skill or it's a mental skill, that's yours to keep. And so it doesn't matter, because eventually your gifts will make room for you. And those skills will be able to be applied and come to the surface. And you will not be able to be held back. In addition to that, we should help and assist those to grow that are with us. So contrary to long-held belief that plants, are always in competition with each other, there's research now that says that mature plants help the smaller ones to grow, and the smaller ones then are able to thrive as a result. And so one example of this is the dandelion plant. And so the dandelion plant actually secretes substances from its roots that helps to keep the nematodes or the worms away. And so they're great companion plants for tomatoes. And so I think for us, let us be dandelions. Let us, as seniors, be able to encourage and to foster. And for those that are doing it already, keep on. And for those that are not doing it, may you start. And even if you choose not to start, at least I would say, make the decision not to be a stumbling block. And so for those that are previous interns that have been with us, feel free to put in some comment in the chat group, or previous SHOs, and let us know, and let your persons that are helping you know, because that too serves as an encouragement to them. And so for an example, for us, assisting those to grow where we are, we decided and structured from our educational division, our internship and our SHO program. And the components of this program is that we meet with each participant individually. We discuss a 5-year career plan, and they put it in writing. We set timelines for exams. They encourage, as a requirement, they develop an audit, and eventually we're able to move that on and submit it for a local or international meeting. Weekly teaching sessions are held on hard topics and soft topics such as this one. And we do practical sessions with the practical components of the specialty. The monthly journal club we were able to institute. It was just a replication of what I had the privilege to participate in and establish in Nassau. We did guideline meetings, and then we do end of rotation exit fellowship. And so the faces may change throughout the years, but the objective and the agenda is still the same. And the guideline meetings are usually consultant-led. And Dr. Isaacs had been our key point person. She would send out the schedule, and we would meet usually in theater when we pre-Dorian and go through the guidelines from the Royal College. And then in terms of our practical sessions and components, so the literature has clearly showed, especially in specialties that are technical, that if you have an opportunity to have these dry labs, that it then in turn improves the performance when it comes to when you actually have to put the activity into practice. And so we've done practical sessions. Unfortunately, we lost our baby doll that had been donated by Dr. Bo in Dorian, but we used that to teach breaches and twin deliveries and repairs, and you name it, practically I found a way for us to be able to construct a way to share and teach. And then the result is that you are able to produce your residents that are able to function. This is Dr. Taylor being the lead surgeon under the direction of Dr. Pura in one of the cases in theater. And then the journal clubs, they also were timely. And when we first started the journal clubs, the consultants actually sponsored them because we didn't have the funding, but they too proved useful. And the results for presentations and local meetings is that we have produced some consistent results as far back as I can remember from the Grand Bahama Medical and Dental Association. ONG has always either taken first or second or both, sometimes both. And we had one of our SHOs, Dr. Branch, she produced the paper that was presented for ACOG back in 2016. And that result was followed up on in 2019, Dr. Maycock, and we really lost a powerful future physician, and we do miss her, Lord rest her soul. But she and Dr. Isaacs under the direction of Dr. Aubrey, and Dr. Maycock under the direction of myself, and that was actually an intern project that she extended. They were accepted, and We as the consultants for the majority hopped on the plane, and Dr. Ward was nice enough to cover, but we were in London and supporting them. And then this year we were fortunate enough as well, once again, to have from Freeport to have some additional 3 posters accepted. Dr. Taylor under the direction of Dr. Aubrey, and Dr. Johnson and Dr. Critchlow under the direction of myself. And this is just the beginning. There's more to come. And then at the end of the rotation, we always do an exit fellowship, whether it's the end of the rotation or we have a departing member of the department, and it gives them an opportunity to share their experience, and it gives us an opportunity to impart some parting words of wisdom. And they always know that they can come back to us. And this is our administrative officers, Dr. Ms. Norval Smith's her mango tree, and it's excellent. She's a key player in making things happen for our department, and we thank her and we appreciate her. But you know, when I always look at everything, the proof of growth is always in the harvest. You know, it's one thing to talk, but where's your proof? And so these are some of our previous interns and SHOs just in Freeport. This is not even touching the ones in Nassau, and not to deflect or try to take any of their credit, because they are who they are, and everyone has played a role in their growth, has played a role in their development in enabling them to get to this point. And we are so very proud of them. So I just wanted to highlight a few of them that I was able to catch up with or able to keep in touch with. And Dr. Knowles, she's a 3rd-year resident in psychiatry. Dr. Pindner, she's a DPH on TV. Dr. Green, he's a pediatrics DM resident year 1. Dr. Lockhart, he's a medicine DM resident. Dr. Duncombe, she's an ONG resident in Nassau. Dr. Dames, a psychiatry resident in Nassau. Dr. Cooper, she's a 1st-year pediatric resident in the US. Dr. Carroll, he's a surgery resident in the US. And he had actually his intern project was supposed to present for the Grand Bahama Medical Dental, but I couldn't get him away from his surgery SHO position at that time. And so Dr. Taylor presented on his behalf, and they still got 2nd place. Dr. Branch, she's an ONG resident in Barbados. Dr. Rigby, he's ONG resident in the UK. Dr. Alexander, she's the DM resident in the ONG Nassau program. Dr. Claire, A&E SHO in Nassau. Dr. Archer, medicine SHO in Freeport. Dr. Colley, he's a pathology resident in the DM program in Jamaica. Dr. Turnquest, she's a PD SHO in Freeport, making her preparations for residency. And Dr. Knowles, who's preparing for her derm residency. She's currently a dermatologic assistant. So the question that I'd like to leave you with is, you know, how are you growing where you are planted? Where are you? What type of environment are you in? And how are you able to try to make that environment more favorable? And how are you able to inspire others? And so for us and our projects that we have in the works under the direction and the leadership of Dr. Paul Ward as the department chair, is that we are anticipating the return of our interns to the Grand Bahama Health Services. We are fully able and fully well able to assist as our record reflects, and that our structure hasn't gone anywhere. Our hospital may have left us and we were displaced temporarily, but we are back. And we are currently trying to outsource some furniture for the on-call rooms. I'm excited and anticipating the growth of other DM programs in Freeport. Many programs have successes, and one of ours is that Dr. Saida Bo, she's evidence that there is the ability for persons to successfully complete their DM in Freeport, in ONG, and move on to higher heights. And in addition to that, we're using our voice as a department to contribute to the education of our community. You know, you get a call from your department chair, the answer usually is gonna be a yes. Yes, when do you want it done? It's done. So Dr. Paul Ward got the call, and he called and said, I need you to speak on X, Y, and Z, and there's no stuttering, no hesitation. No matter what you have to do, the answer is going to be yes. And so there's more to come from us. And so we, on behalf of myself and my colleagues, I just want to thank you for this opportunity to present and to share. And just like any other Bahamian, when you see flowers, we get nosy. And so I saw some flowers as I was passing through the ward, and it said staff of obstetrics, RMH. So I said, that includes me too. So I opened the card, and it was nice to see that it was actually a patient that was appreciative of the care that they had received. And so I thank you, and I encourage you to continue to grow where you are planted. And in case you're looking for extra reading, here are some of the works. And they're available on Amazon. And if you have Kindle Unlimited, it's free. And please leave a review, and thank you so much.
Thank you very much, Dr. Bodie Williams, for sharing your experiences with us. And thank you for the encouragement this morning on purpose and growth, and highlighting the importance of integrity, trust, and leading by example, and especially for reminding us about the Hippocratic Oath. So we don't yet have any questions in the chat. We have lots of comments, and I will read some of them for you. So Dr. Tamika Johnson, thank you so much for your support during my time in Grand Bahama. Dr. Bodie, I will always appreciate you. Dr. Davina Knowles, thank you, Dr. Bodie, for your consistency. Dr. Mandy Pedigan, very timely presentation, excellent. And for the comments that I've missed, it's because the chat is moving so fast with the comments. Dr. Judith Hall, thank you. Dr. Shea, Dr. Greta, excellent presentation. Sean Knowles, excellent presentation. Thank you for sharing this with us. Very humble, encouraging, and inspiring. Dr. Quilling Kapuli. Dr. Estelle Leville, well said, thank you. Excellent presentation, Dr. Pinda Butler. Excellent talk, Dr. Karine Sinqui. Your passion is amazing. Great job, Dr. Bodie. And so essentially, we all feel very humble and inspired by your talk and for encouraging us to look within, and there's always room for improvement and growth. And you posted at the very end, but you glossed over it. You know, I don't know if a lot of people on the call realize that most of those books that you put up are actually books that you are author and co-author of. So tell us a little bit about some of your books while we enjoy the comments in the chat. Thoroughly enjoyed it, a refreshing presentation. Thank you, Dr. Bodie, for this presentation. You are truly an example for how to handle and mentor junior staff.
Thank you. So the one that will be coming in the summer is about polycystic ovarian syndrome, and it's called Surviving and Thriving with PCOS. So I'd like you to look out for that one. That should be out later in the summer. And the one is about breast awareness, because there was a lot of stuff that's written about cancer, but nothing I found written on benign disease. And I started out to tribute to the surgeons which include Dr. Francis, Dr. Shea, Dr. Monroe, and they have given the care to women for breast issues in the country for years. And that's Be Breast Aware. And then I also have a book that was co-authored with Dr. Chantal Asher, who was about obstetrical care as well, that ladies can use for their pregnancy. And then we have one non-medicine book that we also co-authored that's called Scriptures for Every Woman Before You Say I Do. And they're all available on Amazon. And so, thank you.
And so we look forward to having you back again, telling us a little bit more about your books and showing us your books. Dr. Karis Major, good morning, inspiring presentation. Karen Albury, great presentation. Dr. Tanya Pratt, excellent presentation, truly inspirational. And I think, sometimes we tend to forget that pastoral care is a part of medical care and something that we should be thinking about in our practice. And so we all know the challenges of working in a busy public hospital. And so what is one little idea or one little snippet that you can offer us that we can use every day to change what we do and help us grow a little bit more in our practice?
Be you. Be who God designed you to be. Be that person that, like I said, when you look in the mirror, that if you had to take care of you that day, that whatever your actions were would be enough to where you'd be satisfied. Because we tend to have high standards. We, have high expectations. So be that person, taking care of somebody else is willing to meet those expectations yourself.
Well, thank you very much, Dr. Bodie. Like I said, we don't have any questions in the chat because we all feel very inspired and motivated by your presentation this morning. Lena Mortimer Ray's inspiring and motivational presentation. You are truly outstanding in the field. And so before we close, do you have, Dr. Espinosa, very proud of you, do you have any final parting words for us?
Just use, I pray that if you, whatever you remember, whatever you take away, because whenever we have CMEs, everybody gets a little different piece of information that's applied to them. I would just say, just use it to increase or grow in who you are. Don't go back to the status quo. If there's anything you remember, and there's only one thing, try to apply that one thing. And whatever that is for you, let that be.
Well, thank you very much. Dr. Wallace ends off by saying inspirational, determination, perseverance, and faith in God characterize your journey. You are such a blessing to us junior physicians. And Dr. Sinqui, you are truly leading by example and has inspired the people that you touched. So thank you for inspiring us and thank you for encouraging us to inspire as well. Thank you for joining us this morning, Dr. Bodie. And we will invite you back.
Thank you, everybody. Have a blessed day.
Thank you. And thank you very much to our listening audience this morning. And so our next CME will be on Wednesday, the 14th of July. The schedule is fixed, the second Wednesday and the last Friday of each month. We will go until the end of August, and then we will take a break and start back again maybe in October. Please remember to fill out the feedback. The link has been posted in your chat, and the feedback was also sent to you with the Zoom link. We will be applying for 1.0 Bahamas Medical Council CME credit for this lecture. So thank you to our technical staff, which is Dr. Darren Halliday, and thank you to all of you for taking the time out to join us. Have a great day and see you on Wednesday, the 14th of July.